Community Links kicks off on Monday, September the 12th over at the B.B. Colmer Library. And Community Links is a symposium sponsored in part by the hospital, Coosa Valley Medical Center, and the B.B. Colmer Memorial Library. And this kickoff to the season is with our new cardiology team at Coosa Valley Medical Center. And David Schultz joins us this morning. And David, good morning to you, sir.
Thanks for having me.
Thank you for being here this morning. Actually, the Alabama Cardiovascular group's already gotten started here in town.
Yeah, we just started last Tuesday. We will be in the hospital every day, 5 days a week, seeing patients both as on an outpatient basis, as well as seeing cardiology patients in the hospital. Mm-hmm. And that'll be Monday through Friday. And we have a nurse practitioner who's dedicated to this hospital, so they'll be in the hospital all day long. Will be available to any physicians who need to get a hold of us. So we'll have somebody there at all times, and one of us from our group will be in town Monday through Friday.
Yeah, and I'm sure you'll be over at Community Links on Monday.
Yeah,
correct?
So I'm speaking on Monday at Community Links, and so I hope everybody comes out. And
we're getting you a warm up this morning.
Yeah, that's correct. We'll kind of talk about a little bit about what we do and what the breadth of cardiology is, different disease processes that we take care of, what the current technology is in our field. And so I think it'll be a nice overview for people to kind of see what we do.
Heart disease, the number one cause of death for both men and women in this country. That's staggering.
So it's interesting. If you ask people what are they most concerned that they may die of, people may say prostate cancer or breast cancer or things like that. But 1 in 3 people will have cardiovascular disease in their life. So by far and away, it is the most common reason that people die because of cardiovascular disease. So if we can do things to help prevent that. Now, certainly when we see people, we tend to see people that have already developed cardiovascular disease and we're having to take care of a problem. But I think another big part of our job that's very important is helping people to try and prevent.
How do we do that?
Well, it's...
we only have 15 minutes. So.
Really, if you look at the 5 simplest things, it doesn't tell the whole story, but the 5 simplest things, if you have diabetes, take care of your blood sugar. If you smoke, quit. Get your blood pressure under control. Get your cholesterol under control. And then the 5th main risk factor is family history. Now, you can't outrun your genes. Whatever you're kind of born with from your mom and dad, you have. But to be aware that you have a family history of heart disease would maybe make you more motivated to come see one of us earlier so that we can kind of get you on a program. Much better to prevent the disease in the first place than to try and clean up the mess after you've already developed it.
Dr. David Schultz, our guest this morning. He is a part of the Alabama Cardiovascular Group at the professional building in Sylacauga and already seeing patients. And if you would like to get plugged into this group, I guess I can just call and make an appointment, right?
Yeah, call and make an appointment. We're just starting out as of this week, so we've got plenty of appointments available. And actually what our goal and philosophy is to really be able to respond to patient needs quickly. So if a patient needs an appointment that day or the next day, we want to try and be available to see that patient right away. I think the other thing that we're excited about is that we can actually come here to this community so that patients can come and see us near where they live. It's a lot. Nobody wants to be sick.
Really, David, you think about this. It can be a matter of life and death. Just being 40 minutes closer.
Yes, it can. And when you're sick, it's much better to be in a place where you can have your family members around and potentially your pastor or people that can come and help you out and help your family out. And even just on a regular clinic basis, it's a lot easier to drive 5 minutes down the road and see your doctor than it is to have to drive 40 minutes away.
Who else is a part of this team?
So we have the nurse practitioner, Jeff Harrell, who's the guy that's going to be with us every day. Dr. James Taylor is going to be here 3 days a week, and I'm going to be here every Monday. Mm-hmm. And then there's a couple of other guys in my group, Dr. Juan Bernal and Dr. Dale Jones, who are also going to be rotating through here on Thursdays.
Alabama Cardiovascular Group in the professional office building on the campus of Coosa Valley Medical Center. They'll be the special guest over at Community Links on Monday, and that begins with lunch at 11 o'clock and the presentation in the beautiful Harry I. Brown Auditorium. I don't know if you've ever been on that campus. It is gorgeous. Not a bad seat in the house. Cool.
I'm looking forward to it.
And you'll have a captive audience for sure. How has this specialized field changed in the last 10 years?
I think like in any area of medicine, technology drives things quite a bit. So if you look at the treatment of a heart attack, let's say 30 years ago, they might put you in a bed, leave you there for 2 weeks, and if you had the gumption to survive your heart attack, well, then you lived. We've completely turned that on its ear now. We take people to the cath lab in the middle of them having a heart attack and fix their artery while they have a heart attack. So I think that's been a huge change. We have the technology involved with pacemakers, defibrillators. We actually have technology now for when people have rhythm problems of their heart. Instead of just taking medications, we actually can take a catheter up into your heart and find where that rhythm problem comes from and burn it out of your heart and actually cure your rhythm problem. So technology has made a huge difference in our ability to treat patients and to help them live better lives.
How would you like personally for people to describe you as, you know, you're coming here in town with this group, Alabama Cardiovascular Group, and we're talking with Dr. David Schultz and medical doctor, cardiovascular group, and, you know, everybody's wanting a personal feel from their physician or postman or whoever it is. How do you want to be described?
Well, I think sometimes we think about physicians more as the technology side, mm-hmm. but I think technology is used to do what we do. What I'm more interested in is patients feeling like they can just sit down and talk to me, that they feel open to tell me about what's going on, that I'm going to listen to them, that I'm not going to come in there and my head's not going to be buried in a computer screen, and that I'm going to look them eye to eye, and we're going to have a conversation about their health. And I'm going to try and give them my best advice for them to feel better. I want them to feel like they have a connection to me.
Well, certainly Community Links is going to be the kickoff of the fall session with partnership with the Coosa Valley Medical Center and the B.B. Comer Memorial Library, and it's touchdown CVMC, and it is football season, and we can get real excited about sports, and we need to make sure our hearts are healthy to get when we get excited.
That's right. You got to be ready for the fourth quarter.
Yeah. When people make an appointment to see you or another one of the group members of Alabama Cardiovascular Group, how do they need to prepare for that first visit?
Well, I think most importantly is, in this day and age, people have a number of medical problems and things that you wouldn't necessarily think apply to, oh, this is not part of my heart problem, this is part of my other problem. Not necessarily so. All these things kind of work together. So certainly, if we have a good record of what the history is, of what the past medical history is, what medications you're taking, and if we have those things to start with, that really helps us to fully understand you a little quicker so that we can put these things all together. Certainly, I don't think you need to come with nothing to eat and be ready to have a test or anything like that. But having some records, having a list of your medications, I think, and particularly previous procedures and things that you've had, does not need to be a novel or a book. But, having that information, I think, will make things move a lot quicker and a lot easier. But I think that even that's not necessarily required. If you're having a problem and you need to be seen, I want you to feel comfortable coming to see us right away so that we can start the process of getting you well.
Yeah, I was going to ask the question, how far have we advanced in detecting an issue before it becomes sometimes a fatal event?
That is kind of the holy grail of cardiology still. How do we, just like you said, how do we find things before they're going to happen? It's still very difficult for us to predict. I think particularly with cardiology, everybody goes, I'm nervous that I might have a heart attack. How do I know that I'm not going to have a heart attack? And unfortunately, at this point, we have not gotten to the place where we can say, you're going to have a heart attack. What we do know, though, is things that tend to increase your risk for heart attacks. And so if we can kind of look at what your risks are and make some interventions on your risk factors, like I said, simple things, blood pressure, cholesterol, stopping smoking. I mean, if you do those three things, don't smoke, get your blood pressure under control, and get your cholesterol under control, you've made a huge difference today, so that 10 years down the line, we're not talking about you having a heart attack.
Is age, race, sex more deciding factor?
So heart disease doesn't discriminate. It is everyone from every walk of life is at risk for cardiovascular disease. Certainly as people age, sometimes I tell my older patients, sometimes you just live long enough for some of this stuff to catch up with you. So certainly I think age does play a part in increasing your risk. But I think one of the places for years that we had been probably short in our diagnostic skills was we always thought that women were more protected from heart disease than men. If you're a male, you have a higher risk of heart disease. But if you actually look at the numbers, women are more protected when they're younger, but when you look at men and women at 70 years old, their risk of heart disease is exactly the same. And so I think we're trying, I don't know that we're perfect at it, but we're trying to do better, particularly at detecting heart disease in women earlier, and not just saying, oh, you're a woman, you don't have heart disease. We have to be far more accepting to say, hey, just because that's a woman doesn't mean she doesn't have heart disease.
Dr. David Schultz, our guest this morning. He's a part of the Alabama Cardiovascular Group. And if you would like to make an appointment, you can call 256-401-4423. That's 256-401-4423. They're seeing patients now, and they will be the special guest, too, over at Community Links at the B.B. Coleman Memorial Library on Monday, beginning at 11 a.m. Dr. Schultz, thanks so much for coming by and sharing this morning.
Thank you so much for having me. I appreciate it.
We got more Daybreak just ahead. You don't want to miss Toots' tips. College football picks straight ahead.